There are 4 pairs of electrodes you need to attach to the body, each with one black and one red electrode connection. Connect the electrode cables to the electrodes recommended by Sika, and ensure that the electrodes are still within their shelf life period. Disinfect the areas at which the electrodes will be placed, and use an electrode spray or gel to optimize RGE conductivity to the electrode, and to avoid so-called electrode errors. To position the first electrode on the back of the respective wrist, imagine a line between the heads of the ulna and radius, which protrude slightly at the wrist position. Position the electrode midway between the heads of the bones, so that rather than lying on the line, it is adjacent to the line on the side nearest the hand. Position the next electrode on the back of the hand. To do so, imagine a line between the knuckles of the index and middle fingers. Position the electrode midway between the knuckles, so that rather than lying on the line, it is placed on the right side of the line. The distance between the conductive surface of the electrodes should ideally be 5 centimeters or 2 inches, in order to avoid false measurements with inaccurate measurement results. Sometimes you may not be able to achieve this distance when the subject has small hands. If that's the case, the red hand electrode can also be placed between the joints of the index and middle finger on the palm of the hand. Repeat the same procedure on the other hand. Place one electrode on the back of the respective ankle. To do so, imagine a line between the heads of the tibia and fibula. Position the electrodes midway between the bone crests that protrude slightly on the ankle joint. Do not place the electrode on the line, but rather next to the line on the foot side. Position the next electrode on the back of the foot. To do so, imagine a line between the joints of the second and third toes, extending towards the middle of the foot. Position the electrodes midway between the joints, so that instead of lying on the line, they are placed on the ankle side of the line. Place the mat with the logo facing upwards on the subject's knees. Feed one set of cables using the most direct route, and without crossing the body or the mat, to the nearest hand or foot respectively. Connect the red push-button adapter to the electrode farthest away from the body's center. It is used to feed electricity into the body. In order to compensate for so-called skin transition resistance, it is important to have a high degree of conductivity. Conductivity can be restricted as a result of dry, calloused skin or hand cream, for example. Connect the black push-button adapter to the electrode near to the body center. It is used to measure resistance. If this electrode is moved in the direction of the forearm, for example, less resistance will be measured from the arm. This leads to falsified results, as all final values are calculated using the measured resistances. Therefore, precise placement is important. The black electrodes always need to be positioned closer to the center of the body than the red electrodes. An accurate placement of the electrodes is crucial for reliable measurement results. Red and black cables are not interchangeable.